Okay, here is what you need to know about monkeypox. It may not be causing the same global panic that COVID-19 has, but the infectious disease is still spreading, with cases rising in several U.S. states. This is in a report at Study Finds. World health officials are holding off on calling the monkeypox a public health emergency, but here's everything you need to know to keep yourself safe this summer. First, what is monkeypox? It's a rare disease which belongs to the same family of viruses as smallpox. The virus was discovered in 1958 after 2 outbreaks among research monkeys. Despite the disease getting its name from monkeys, the Center for Disease Control and Prevention says its true origin, it's a mystery. The World Health Organization says the first human case of monkeypox emerged in 1970 in a small child from the Democratic Republic of the Congo. Before 2022, nearly every case of monkeypox involved a person in Africa or someone who traveled to a country where the disease is more common. Now, what are the symptoms? According to the World Health Organization, the initial symptoms of a monkeypox infection include a fever, intense headache, muscle aches, back pain, fatigue, and swollen lymph nodes. 1 to 3 days after the fever begins, a patient with monkeypox can develop a rash that usually starts on their face and hands and feet. The rash turns into clusters of lesions on the skin. They raise up and fill with clear or yellowish fluid before eventually crusting over, drying up, and falling off. A patient with monkeypox can end up having just a few of these lesions or develop several thousand all over their body. Monkeypox symptoms last between 2 and 4 weeks before going away with little to no additional treatment, and it's rare for a case of monkeypox to send someone to the hospital, and even more rare for someone to die from the disease. Overall, 3 to 6% of all monkeypox patients die, and these cases typically involve children or adults with other health complications. Monkeypox easily spreads through physical contact with the infectious rash, scabs, or a patient's bodily fluids. Now, a new report has discovered high viral loads in the saliva, urine, semen, and fecal samples of most monkeypox patients, so prolonged face-to-face contact like kissing can spread the disease. This also means having sex with someone with monkeypox could possibly spread the disease as well. Scientists say it's also possible for a pregnant woman to spread monkeypox to their unborn child. And if that weren't enough, they say that animals can carry the disease and pass it along through biting and scratching. The CDC also says there's a possibility of contracting the disease by eating an animal that had monkeypox. A patient is considered infectious until the lesions go away and a fresh layer of skin forms over those areas. The CDC says antiviral drugs created to deal with smallpox work well on the disease if needed, but as we said earlier, generally the virus runs its course without medication after a few weeks. The most urgent piece of medical advice health officials have is for infected patients to isolate themselves so they avoid spreading monkeypox through physical contact. There's also a vaccine that prevents smallpox, which also works on monkeypox. Okay, that should give you all of the basics on this one. As always, check with your doctor for more information. You can check out more info on this and other studies by clicking the link in the description below and head over to studyfinds.com.